Welcome to Life Care for You. In today's video, we're exploring a topic that affects millions worldwide: anxiety disorders. While occasional anxiety is a normal part of life, anxiety disorders represent a different, much more intense reality. Let's take a closer look at what they are, how they manifest, and what can be done to manage them effectively. Anxiety. It's that unsettling feeling of worry or fear that strikes before a big exam, a job interview, or a major decision. But imagine feeling that way nearly all the time, even when there's no clear reason for it. That's what life is like for those living with anxiety disorders, a constant state of unease, fear, or dread, often about everyday things. It's more than just stress, it's a relentless battle that can take over every aspect of life. What exactly are anxiety disorders? Anxiety disorders are a group of mental health conditions characterized by excessive fear or worry. These feelings are often out of proportion to the situation at hand, and they can become so overwhelming that they interfere with daily life. There are several types of anxiety disorders, including generalized anxiety disorder, GAD, panic disorder, social anxiety disorder, and specific phobias, each with its own unique challenges. Anxiety disorders don't just come and go, they're persistent, often lasting 6 months or longer. But what makes them so difficult is that they don't just affect the mind, they affect the body too. Racing thoughts, a pounding heart, sweating, trembling, these are just a few ways anxiety takes a physical toll. Symptoms of anxiety disorders. Anxiety disorders can manifest in different ways depending on the individual and the specific type of disorder. Some common symptoms include excessive worrying, constantly feeling on edge or worried, even when there's no immediate threat. Restlessness, difficulty staying calm, often described as feeling keyed up or unable to relax. Fatigue, anxiety can be mentally and physically exhausting, leading to chronic fatigue. Difficulty concentrating. Persistent worry can make it hard to focus, as thoughts constantly drift toward fears and concerns. Physical symptoms. Rapid heartbeat, muscle tension, sweating, trembling, dizziness, or shortness of breath. Sleep disturbances. Trouble falling asleep or staying asleep due to racing thoughts. These symptoms can be more pronounced in certain situations, like social settings, for those with social anxiety, or during panic attacks, for those with panic disorder. What causes anxiety disorders? Anxiety disorders don't have a single cause. They are the result of a complex interplay between genetic, environmental, and psychological factors. Let's break it down. Genetics. Anxiety disorders can run in families. If you have a family member with an anxiety disorder, you're more likely to develop one as well. Brain chemistry. Imbalances in neurotransmitters like serotonin and dopamine can contribute to feelings of anxiety. These chemical messengers help regulate mood, and when they're out of balance, it can lead to heightened anxiety. Life events and trauma. Stressful or traumatic events, such as childhood abuse, a car accident, or the death of a loved one, can trigger the development of an anxiety disorder. Even long-term stress from work, relationships, or financial problems can be a factor. Personality. Some individuals may be more prone to anxiety disorders due to their personality traits, such as being naturally more cautious or having low self-esteem. Substance use. Alcohol, caffeine, and certain drugs can exacerbate anxiety or even trigger it in some individuals. Understanding these causes helps us realize that anxiety disorders are not a personal failure or a lack of willpower. They are rooted in real, tangible factors that affect both the mind and the body. Treatments for anxiety disorders. Living with anxiety doesn't mean suffering in silence. There are effective treatments available that can significantly reduce symptoms and improve quality of life. Treatment usually involves a combination of therapy, medication, and lifestyle changes. Let's take a closer look. Cognitive behavioral therapy, CBT. CBT is one of the most effective forms of therapy for anxiety disorders. It focuses on identifying and challenging negative thought patterns that contribute to anxiety and replacing them with more realistic, balanced thoughts. This therapy also involves developing coping strategies to manage anxiety-provoking situations. Medications. Several types of medications can be helpful in treating anxiety disorders. These include antidepressants. Medications like SSRIs, selective serotonin reuptake inhibitors, and SNRIs, serotonin norepinephrine reuptake inhibitors, are often prescribed to help regulate mood and reduce anxiety. Benzodiazepines. These medications provide short-term relief by calming the nervous system, though they are not typically recommended for long-term use due to the risk of dependency. Beta blockers. These can help manage the physical symptoms of anxiety, such as rapid heartbeat and shaking. Mindfulness and relaxation techniques. Practices such as meditation, yoga, deep breathing exercises, and progressive muscle relaxation can help individuals manage anxiety by calming the mind and body. Lifestyle changes. Making changes to your daily routine can also help alleviate anxiety. This includes regular exercise, a healthy diet, and adequate sleep. Reducing caffeine and alcohol intake can also make a significant difference in anxiety levels. Support groups. Joining a support group can provide a sense of community and belonging, where individuals can share their experiences and coping strategies with others who understand what they're going through. Thank you for watching Life Care for You. Anxiety disorders can be overwhelming, but with the right treatment and support, they are manageable. Remember, this video is for educational purposes only. If you or someone you know is struggling with anxiety, consult a professional healthcare provider for personalized treatment. Stay informed, stay strong, and take care of your mental health.